Hi, everyone. A quick note about the next few episodes. We wanted to create for you a consultation in progress that I could relay to you and you could hear the types of advice that I give to my patients. But because of HIPAA, we couldn't actually use a real patient. So you're going to hear real patient questions, but not a real patient. And we hope that this helps you get the information you need for an in-depth discussion of a patient's symptom or problem.
Every time I'm on call, I admit somebody for nausea and vomiting. Every time I'm on call, it is a different reason. Some of those are chemotherapy 2 days ago, didn't pick up their medicines, didn't take their medicines, didn't know how to take their medicines, didn't know there were medicines at the pharmacy. That's one way. Another way is real bowel blockage, needing a mechanical intervention of some kind, like drainage of the stomach or help with constipation or even a surgery to relieve blockages. But those are very unusual and severe cases. And then there are a lot of nausea that is treatable with the right combination of IV fluids, medications, time, appropriate changes in diet, and good support at home. And I'd love to believe that every one of those admissions is preventable. I know it's not, but I'd love for all of you to have the knowledge and the advice that I have for my patients to try and keep you out of the ER.
Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Hi, everyone. Welcome back to Season 4 of The Cancering Show. We are so excited to be back in the studio and planning lots of new episodes for you all. We are interested in hearing from you and getting your questions and getting those answers to you. So keep the questions coming. We have several from over the summer, and we are going to get to those in episodes as we come forward. But we're going to start with a new series on symptom management. You know, all the time I get questions in the office about common cancer and chemotherapy side effects, or even radiation side effects like nausea, pain, neuropathy, and many others. And we're going to go through those one by one, episode by episode, and get your questions answered about how to manage these. For me, these episodes are so important because now I can have my patients come to this episode and listen to my advice on nausea that I almost never have time to give to its fullest extent while we're in the office together. So I'm super excited. Let's get started.
Hey, Dr. Pierce, I have some questions for you. What is it about cancer treatment that causes nausea? Why am I so sick to my stomach all the time?
So cancer treatments can cause nausea in a lot of different ways. The most common way is slowing down our GI tract. So the stomach is slow to empty. That might lead to difficulty with acid reflux type symptoms. The bowels are slow to empty, which can lead to constipation. There are some chemos, a little asterisk, of course, is there are some chemos that cause diarrhea and faster motility. We think of this more commonly, though, with radiation or with immunotherapy. So all of these things can make you feel queasy, and a lot of them we treat rather than go directly to treating the nausea. We treat the cause.
What advice do you have for how to treat my stomach?
So the first thing we're going to tell you when you're treating nausea is that you get nausea medicine in the IV the day of your chemotherapy. For those of you doing radiation or immunotherapy, you will receive instructions on medicine for nausea, and that's the first thing you want to take is the medicine that your doctor has prescribed. If you're having nausea every day, you should be on a patch for nausea prevention. And if you're not, it's great to ask your doctor if a patch for nausea prevention is a good option for you. Second thing we're going to tell you to do is to look for the underlying causes. The acid reflux, the constipation, the diarrhea, are these things that you need treatment for? And then the third thing that we're going to tell you to do
is to reach out to your healthcare providers because they may have other ideas and there might be another cause. For example, you might be taking a medication that is causing nausea. Sometimes when people get anxious, they can have a symptom of nausea that we treat with anxiety medications. And there can be other underlying problems that we really want your healthcare providers to help you troubleshoot. I want to spend an extra minute on constipation because I think too often we think about diarrhea with radiation and chemotherapy, and we know to take diarrhea medicines. If for any reason you don't know that, let me quickly say for diarrhea medicines, you take one medicine, either the over-the-counter or the prescription medication at the first symptom of diarrhea, and you take it again at the second symptom of diarrhea, and you can take those medicines multiple times a day, but we encourage you to seek guidance from your healthcare team. For constipation, which I find in my practice is the much more common problem, the advice compared to traditional constipation advice is a little bit different. So we actually don't tell you to take fiber when you are constipated related to your chemotherapy and actually to your nausea medicine. Those do cause constipation. And so what we're going to tell you to do is, of course, try and drink as much fluid as you can, to take a stool softener and a laxative such as Miralax daily. Those help the bowel to empty and to keep you feeling well. The other thing that as you start to improve from your chemotherapy, we're going to recommend that you add back movement. Movement is so important to patients and the good bowel health. And I will tell you that too often we see that patients who are having more trouble getting up and moving also have more trouble with constipation. In any small amount, even walking around the house, making sure that you're eating your meals at the table instead of in the lounge chair can make a difference in terms of getting those bowels moving again. And lastly, we recommend a probiotic. The chemotherapy can affect what we call our microbiomes, the normal bacteria that are in our colon. And we want to make sure that you reinvigorate that bacteria with a probiotic. A good probiotic is one that has at least 4 strains of bacteria and 10 million units. With that advice, you can go to any supplement store or grocery store and take any one off the shelf.
Okay, when I'm nauseous, when do I call my doctor? Or am I just supposed to be feeling like this during chemo?
That is such a great question, and I want to encourage you to stay in touch with your healthcare provider if you're having persistent trouble with nausea, particularly if you're vomiting. Because we have so many good treatments for nausea these days, vomiting with chemotherapy daily is unusual. And we want you to call your doctor for repeated days of vomiting. And definitely call your healthcare provider right away if you cannot keep fluids down and are not able to keep down liquids. So first and foremost, your doctor can give you IV fluids in the infusion center and help prevent you needing to go to the emergency room. They can actually give you IV nausea medicines that can help break that kind of nausea and vomiting cycle and help you get something in your stomach that will keep the queasiness down. But in addition to that, they can prescribe medications that are not given by mouth. We find sometimes that patients can get in that cycle when they aren't able to keep down their nausea medicines and then, of course, start throwing up. So remember, as we said before, there are patch medications. There are medications you can take sublingually. There are medications given by rectum. And then, of course, IV. And in the cancer centers, we have access to all of those options. And we want to make sure that you have some options at home so that you can use those either in the middle of the night or over the weekend when you can't get to us, so that we can prevent dehydration and the things that come after that, which can actually make a cancer patient critically ill. So please keep in touch with your healthcare provider and don't just expect vomiting from your chemotherapy.
Sublingual, is that under the tongue?
Sublingual is under the tongue.
Are there alternatives to traditional treatments for nausea or something I can eat?
There are so many alternative therapies for nausea that they are almost too many to list in this podcast. There are some over-the-counter supplements like vitamin B6 that people have found to be helpful. Some of my patients actually swear by the nausea bracelets that are used for motion sickness, the magnet bracelets. Common motion sickness medications like the scopolamine patch behind the ear can help some patients, particularly those that are suffering from nausea associated with dizziness. And we've also had patients with good success from acupuncture. So if you are finding that the nausea medications are not providing you enough relief, or if you just don't like the way those medications make you feel, seeking alternative therapies is at least worth a try. All right, I can't talk about nausea and not talk about medicinal marijuana. I get this question from patients all the time. Should I also use medicinal marijuana? And, that comes in many different forms and lots of different names for it. Cannabis, THC, CBD. The drug that we can prescribe is called dronabinol, or Marinol is the brand name. So there are all different ways and formulations that a person can seek and receive the benefits of medicinal marijuana. So can it treat nausea? Absolutely. It can treat nausea very well. It can actually increase appetite for patients who are losing weight, and in many ways is a fantastic medication to go with those problems related to chemotherapy because it doesn't have the side effect of constipation that we worry about from other medications. That being said, every formulation is different. And if you are buying something from a dispensary, there are all different kinds of laws all over the country as to what is legal and what is not legal. And we encourage you to seek advice from your physician, obviously, to purchase from a reputable legal distribution center. We do encourage you to look those up on the Better Business Bureau to make sure it is reputable. And lastly, to stay in good contact with your physician because there are options for prescription medication. In particular, the dronabinol is formulated specifically to address chemo, nausea, and vomiting. And so that's usually what I start with for my patients. And if they have a good effect, but they are wanting additional treatment related to pain or to neuropathy or to anxiety, then we may move on to other medicinal marijuana products that are legal in our area. So I hope that's helpful to give you a starting ground to have that conversation with your physician about marijuana.
So I know I need to eat. What are some things you'd recommend to start with? What about crackers? What about dry cereal?
So for our patients on chemotherapy, particularly those first couple of days after chemo, we really recommend that you eat those comfort foods. I say to my patients, if it looks good, sounds good, and smells good, it'll probably stay down. And if it doesn't, don't bother. But the usual stuff that you hear of for comfort foods, chicken and rice, chicken noodle soup, those things that you find comfort in when you're not feeling well, I can tell you, my daughter would say ramen noodles. So whatever that is for you, to find those comfort foods and surround yourself with them. Some common things to avoid: spicy foods. Even tomatoes can be too acidy. That includes things like tomato sauce, fresh tomatoes, and those spicy salsas and things like that. And then if you really can't keep down solid foods, there are some things that you can do. First and foremost, we tell you not just to drink sips of water. If you can get in sips of Pedialyte, Gatorade, something with electrolytes in it. If you can try something a little bit heftier than that, you can try a protein drink like Ensure or Boost. They actually, both of those brands do now make a clear liquid protein drink, and that can give you all the nutrients that you need to actually serve as a meal replacement. Now, we don't recommend that you do meal replacement because we don't want you losing weight during chemotherapy. But if you need to do that every now and then to keep something down, certainly it will make sure that you don't get malnourished. And once you can get in a little bit more protein, then you can try some saltine crackers. You keep those down. Then you move on to the soups, and then from there to chicken and rice, and then from there back to your usual diet. I would refer you back to episode 29. Dr. Wesley McWhirter was with us talking about culinary medicine, and he actually had some great tips for patients and their eating during chemotherapy. Again, that's episode 29 from the previous season. So we've just been through all you need to know about nausea for chemotherapy and radiation treatments. First, understanding what the cause is, getting to the source of that cause. If you're having trouble with that, I would encourage you to keep a journal so that your symptoms can be tracked and it can help you to figure out exactly what is causing that nausea for you. And I just want to say again, I can't say it enough, Do communicate with your healthcare team regularly. Don't just expect to feel bad and soldier through. I tell my patients all the time that we want to hear from you. We want you to call us if you're throwing up. It is not normal to do that repeatedly because we have so many nausea medicines in our arsenal, and we only give you one or two to start with because we don't know how you're going to respond. But you can call us, we can talk you through it, and we can add to what you have at home. And we've been through some of those treatments, the prescription treatments, the over-the-counter medications, even the alternative treatments that you can try at home, and of course, those culinary treatments, the ones that your caregiver or partner makes on the stove for you. So we hope in this you find the solutions that will help you get through your chemotherapy with the minimal amount of nausea, because you should not have to suffer through that in this day and age. Again, thank you again for listening. We're super excited to be back for season 4. We hope you've learned a lot from this symptom management episode, and next we're going to be doing pain. I promise you don't have to suffer through it. So we'll give you some good advice. Come back next time, and until then, keep cancering and take care of yourselves. Again, thanks for listening to The Cancering Show. And don't forget to submit your questions at cancering.com. We're here for all of those questions and we'll get you the answers. This show is brought to you by the USA Health Mitchell Cancer Institute. MCI is a leading-edge cancer research and treatment center built to fight cancer in Mobile and Baldwin County. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment area of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or find us on Facebook, Twitter, and Instagram. The Mitchell Cancer Institute is a member of USA Health, the health system for the University of South Alabama. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.